All right, hello everyone, and welcome to today's edition of the Extracellular Vesicle Club. This is an ICEV event that we do weekly, and my name is Kenneth Whitwer. I'm Chair of Science and Meetings for ICEV, and it's my pleasure today to introduce the lab of Professor Qing-Ling Fu, who is joining us from Guangzhou in China, and she has a lab there at the Sun Yat-sen University. So she is an ICEV board member. She became a board member in this iteration of the ICEV board. And for some of the EV clubs this year, we're going to be featuring ICEV board members and letting you get to know a little bit about them and the kind of research that they do. So Qing-Ling, thanks so much for joining today and for organizing this journal club with us. And really appreciate your time and your expertise that you're sharing today. So I just wanted to ask you a couple of questions so that the audience can get to know you a little bit better. Could you just introduce yourself and tell us about when you became interested in extracellular vesicles and why that is?
Yeah. Firstly, many thanks for Ken's invitation. And more than 10 years ago, I worked on the effects of mesenchymal stem cells on allergic airway inflammation. And we found that MSCs promote or prevented allergic airway inflammation while working on several immune cells. And we just found that we and other studies also have found that MSCs could induce their immunomodulation while cell-cell contacts or some soluble factors and exomes. Exomes or SEVs released by MSCs have striking advantage over the cells, such as lower immunogenicity, convenient storage, and high biosafety. Thus, MSC SEVs have been identified as promoting cell-free therapeutic agent for some disease. So I think this SEV, this topic about SEV is very interesting. So about 5 to 6 years before, we began to work on the SEV, and we investigate the effect of SEVs derived from MSCs on the immune cells in allergic airway inflammation, including T lymphocytes, dendritic cells, or macrophages. And we also investigate the some SEV or exome derived from macrophages on the pathogenesis of allergic rhinitis or asthma. So I think this SEV topic is very interesting.
Very good. Well, thanks for sharing that with us. And I wanted to ask you too about, so how did you become affiliated with ICEV then? And I think that you are part of the Chinese Society for EVs as well. Could you tell us a little bit about that?
Yeah. And as CSEP, it was held in 2017, and CSEP also held annual meetings each year. And as you know, and Professor Lei Zheng is also the chairman of Education Committee, and Lei is also the vice president in CSEP, and I is a member of CSEP, and another member of CSEP is Professor Hang Yi from Tsinghua University, and he is the vice chairman of CSEP, who used to be the director of ICEV, and currently is the vice editor of JEV. So CSEP works EV research in China, and more Chinese scientists works on the EV research and also have good results. So Thank you.
Very good. Very good. Well, thanks for sharing that that growth with us. And so today we have you've chosen a very interesting topic, and that is the role of EVs in insulin sensitivity. And so you've looked at two papers, one from 2017 and one from just a few months ago, that come from Gerald Olewski's lab. I'd like to ask you now to introduce the topic and our speaker for today. Shubin Fang, thank you for joining us. So, Qing-Ling, if you could tell us a little bit about Shubin.
Yeah. Let me introduce Shubin, our speaker. Shubin Fang was my PhD student and graduated 1 year before. He's currently the postdoc in our hospital, the first affiliated hospital, Shubin University. His research interests mainly focused on the therapeutic effect and the mechanism of MSCs and MSC-SEVs on allergic airway inflammation. And his works was published on several well-known journals, including JEV. Now he continued to work on the therapeutic effect of MSC-SEVs. Furthermore, he's also working on the immunoregulatory effect of plasma EVs and the immunocell-derived EVs, including macrophage-derived allergic airway inflammation. So today, he would share with us two combined papers on the role of EVs derived from macrophage insulin sensitivity. Yeah, should be microphone is yours.
Okay.
Share your screen.
Okay. Wait a minute.
Please share your.
Okay, sure. Is that okay? Can
yes.
everyone see my screen?
It looks good.
Yes.
Oh, that's good. Okay. Many thanks for Dr. Fu's kind introduction, and I also would like to thank Dr. Kenneth for giving me the opportunity to present in the JV Club. So my name is Shubin Fan, and I now work as a postdoc in the first affiliated hospital, Shang University, and the topic of my presentation today is the role of EV derived from macrophages in insulin sensitivity. So before starting my topic today, I would like to briefly introduce some of my previous work. So as mentioned by Dr. Fu in her introduction just now, I have been mainly focused on the therapeutic effect of MSEV on allergic airway inflammation during the past 5 years. And we found that MSEV in part could reduce allergic airway inflammation through immunoregulation on ILC2s and macrophages via the microRNAs or proteins containing the EVs. And this work has been published on journals like JV and Cell Death and Disease. So after that, I started to become interested in the role of EV in the pathogenesis of allergic airway inflammation. So as blood sample is the only way for me to obtain enough EV from AR patients for our function experiment. So I then try to investigate the role of plasma EV in the pathogenesis of allergic rhinitis, especially the differentiation of Th2 cells. And we also try to understand whether or not the microRNAs and the proteins contained in EVs will contribute to their immunoregulatory effect. These results are currently waiting to be published. So because as we all know, because plasma EV are a mixture of EV derived from different cells, I then want to know the effect of EV derived from immunocytes in allergic airway inflammation. So it has been widely reported that macrophages play an important role in allergic airway inflammation. So I would like to do some work on macrophages EVs in the future. So, and this is the reason why I want to present this paper to you. So although there are two papers for you, but in my presentation, I will mainly focus the one that published recently. So the title of this paper is Micro690 and Asosomal derived microRNA from M2 polarized macrophages improve insulin sensitivity in obese mice. So this work was published by Dr. Olewski from Department of Medicine, University of California, USA. So in this article, the authors use the term exosomes. However, I'm going to use the term EV in my following presentation to meet the criteria of MySAF 2018. So first, I will introduce the background of this study. So as we all know, insulin resistance is an antecedent defeat in patients with type 2 diabetes, and obesity is the main driver of insulin resistance in humans all over the world. It has been found that obesity causes insulin resistance in part through inducing chronic inflammation in adipose tissues. So as a hallmark of tissue inflammation, obesity results in the accumulation of pro-inflammatory macrophages in adipose tissues and is the major source of inflammatory mediators such as the galectin-3 and other cytokines. Also, macrophages can be generally divided into M1 and M2 macrophage, and it has been reported that the M2 macrophages can regulate tissue remodeling and inflammation resolution and maintain systemic insulin sensitivity and glucose homeostasis. So in 2017, Dr. Olewski, the same research group as the paper I present today, published the paper in Cell. So this paper showed that the microRNAs contained in EV released by lean adipose tissue macrophages is beneficial in insulin sensitization. In adipose tissue of diabetic mice, the level of M2, the level of M2 macrophages were significantly increased. Significantly decreased in adipose tissues. However, although the M2 macrophage is good for insulin sensitivity, it is challenging to enhance the proportion of M2 in the context of obesity. So therefore, in this paper, the author mainly investigates whether or not the EV released by in vitro induced M2 macrophages can improve insulin sensitivity and the related mechanisms. So the author first isolates and characterized the M2 EVs. The M2 EVs because the low level of macrophages in adipose tissues of lean mice. So it takes about 20 to 25 lean donor mice to get enough EV for experiment. So it will be much challenging to do in-depth mechanism study. Therefore, instead, in this study, they also treated mouse bone marrow derived macrophages with interleukin-4 and interleukin-13 to direct them towards an anti-inflammatory M2-like phenotypes in vitro. So in panel A and B, we can see that the M2 EVs were isolated by using combination of differential ultracentrifugation and the size exclusion chromatography. So in panel C and D, we can see that the M2 EVs are small particles with a diameter of about 50 to 200 nanometers as measured by TEM and nanosite. So in panel E, we can see that the expression of EV-specific markers such as the CD63, TSG101 is expressed in was positive in M2 EVs. So then they also further examine whether the M2 EVs can be taken up by intraperipheral insulin target tissues after intravenous administration to the high-fat diet mice. After intravenous injection of about 1 billion PKH26 labeled M2 EVs per mouse, we can see that the red fluorescent PKH26 was present in liver, skeletal muscle, and epididymal fat. So this demonstrated that the M2 EVs can be taken up into these tissues. So to establish a high-fat diet mouse model, the CD57 were fed with a high-fat diet for 12 weeks. And these mice were treated with about 1 billion EV transfer week in the last 4 weeks. So we can see that all the recipient mice had similar body weight and glucose-stimulated insulin secretion was also similar after 4 weeks of treatment of M2 EVs. So in the glucose tolerance test, we can see that the glucose level in mice treated with M2 EVs were low at different time points after glucose injection. In the insulin tolerance test, we can also see that the glucose level in mice treated with M2 EVs were also low at different time points after insulin injection. We know that the insulin can stimulate the AKT phosphorylation in target tissues. So higher level of AKT phosphorylation will represent higher insulin sensitivity. So in panel C to E, we can see that the insulin stimulated AKT phosphorylation in liver, skeletal muscle, and fat tissue the AKT phosphorylation in this tissue are increased by the M2 EVs. So this result suggested that the M2 EVs administration led to a significant improvement in glucose and insulin tolerance. So then the author further evaluates the effect of M2 EVs on insulin action in adipocytes, myocytes, and hepatocytes in vitro. So all these cells were treated at the concentration of 1 million EVs per 500,000 cells. So in panel A and B, we can see that the M2 EVs promote glucose uptake in both adipocytes and the myocytes. So in panel C, we can see that the M2 EV treatment led to a higher glucose output in the primary hepatocytes. Also in panel D to F, we can see that the M2 EV treatment also promotes the AKT phosphorylation in adipocytes, the myocytes, and the hepatocytes, which are consistent with the insulin sensitizing action of these EVs. So taken together, all these results above suggested that the M2 EV mitigates the obesity-induced insulin resistance in vivo and in vitro. Then what it is the mechanism involved in the effect of M2 EVs, as it has been widely reported that the microRNAs contained in EVs are very important components for the function of EVs. So the authors next focus on the microRNAs in M2 EVs in the following mechanism study. So to examine the importance of microRNA in M2 EVs, the author generates a mouse model with myeloid-specific knockout of DICER, a key ribonuclease responsible for producing mature microRNAs. So in panel A, we can see that the M2 macrophage derived from the DICER knockout mice produce microRNA-free EVs. Also because micro-223 is a myeloid cell-specific microRNAs. So in panel B, we can see that the micro-223 cannot be detected but in the EV released by the DICER knockout macrophages. So these results together suggested that the cell specific knockout of DICER is able to produce microRNA-free macrophage EVs. And we named these microRNAs, and we named these microRNA-free M2 EVs as DICER knockout EVs, M2 EVs. So the author then compared the effect of M2 EVs and the DICER knockout M2 EVs in the insulin sensitivity. So in panel A, we can see that the treatment of adipocytes with DICER knockout M2 EVs show significantly lower glucose uptake than those treated with M2 EVs. Similar result was found in panel B. As you can see in myocytes, the glucose uptake was also lower in those treated with DICER knockout M2 EVs. And in panel C and D, we can see that in glucose tolerance test and the insulin tolerance test, the glucose level was both significantly higher in Dyson knockout mice. In Dyson knockout Dyson knockout M2 EVs compared with those treated with M2 EVs. So all these results suggested that the M2 EVs lost its effect after removing the EV microRNAs, indicating that the microRNAs are responsible for the effect of M2 EVs. So after confirming that the microRNAs are the key component contributing to the effect of M2 EVs on insulin sensitivity, the author then further investigate which microRNA is responsible for their effect, because the author have previously established the EV microRNA profiles in obese adipose macrophages and the lean adipose macrophage EVs, and they found the microRNAs profile overexpressed in M2 macrophages EVs. Among these microRNAs, five microRNAs, such as the microcis9, cis00, were increased the most significantly in M2 EVs. Then they also further assess these five overexpressed microRNAs using a adipose glucose transport screening assay. We can see that except for the microcis90, the other four microRNAs was observed no effect on enhancing the insulin sensitivity. So overexpressed microRNAs, and then as for B, we can see that the M2 macrophage derived from adipose of high-fat diet mouse has lower level of microcis90 than that from normal short diet mice. Similarly, we can see that the level of microcis90 was high in M2 macrophages and the M2 EVs. As you can see in panel C and D, also after systemic administration of M2 EVs to the mice, the level of microcis90 in liver and the epididymal fat and the skeletal muscle were all significantly increased. So these results suggested that the microcis90 could possibly lead to improved insulin sensitivity. So to confirm this idea, we also use a synthetic CY3 label microcis90 mimesis and tested whether microcis90 lead to an insulin sensitive phenotype. So in panel F, the immunofluorescent results show that the microcis90 mimesis is efficiently delivered into key metabolic tissues, such as the liver, the skeletal fat muscle, and the liver and the fat tissues. So in panel G, we can see that the transferred microcis90 was significantly overexpressed in the key metabolic tissues after injection of the microcis90. Also, microcis90 show no effect on the body weight of the mice, as you can see in the panel H. So as expected, the microcis90 significantly decreased level of glucose at different time points in the glucose tolerance test and the insulin tolerance test. Also, the microcis90 significantly increased level of AKT phosphorylation in the liver, the skeletal muscle, and the epididymal fat. Also in panel A, we can see that the number of macrophages in the adipose tissue show no significant difference after treatment with microcis90. However, the level of M2 macrophages was significant significantly increased by the microcyst90, as you can see in panel B. Also, the expression of pro-inflammatory genes was also significantly reduced by the microcyst90. So all these results suggested that the microcyst90 might cause enhanced insulin sensitivity, but these results are mainly from in vivo studies. So they also further conducted in vitro studies. So similarly, in the in vitro studies, we can see that the microcyst90 mimesis can promote the glucose uptake in all the 3 cell types and increase level of AKT phosphorylation in adipose tissues. To further understand the regulatory effect of microcyst90, they also performed the RNA sequencing analysis on adipocytes. So we can see that the overexpression of microcyst90 led to upregulation of the pathway such as the JAK STAT signaling pathway and the insulin signaling pathway, but it suppressed the pathways such as the glutathione metabolism. Also, microcyst90 mimesis promotes the M2 polarization and decrease the pro-inflammatory cytokines in the macrophages. So all these in vitro and in vivo results indicated that the microcyst90 is enhancing, insulin sensitizing microRNAs. So all the above function experiments was performed using microcyst90 mimesis. However, it might be different if the microcyst90 mimesis was expressed in EV that containing the essential lipids and the protein cargos. Also, microcyst90 might need to work together with other microRNAs to enhance the insulin signaling. So therefore, the author transfected the microcyst90 mimic into macrophages obtained from the myeloid dicer knockout mice. In this way, they can obtain the microcyst90 enriched macrophage EVs. So in panel A, we can see the flow cytometry analysis so that the microcyst90 was significantly increased in the capsule macrophage EVs. So in panel B, we can see that level of cyst90 were also significantly increased in macrophages and the macrophage EVs as demonstrated by PCR. So in panel C, the high-fat diet mice were treated with the microcyst90 enriched dicer knockout macrophage EVs. And we can see that robust microcyst90 was delivered to metabolic tissues such as liver and the skeletal muscle by immunofluorescent staining. Also, to evaluate the impact of microRNA cyst90 enriched EVs on insulin sensitivity, high-fat diet mice were injected with microcyst90 enriched EVs and control EVs for 5 weeks. So in panel A, we can see that the microcyst90 macrophage-derived EV treatment led to a greater accumulation of microcyst90 in liver and skeletal muscle and adipose tissues. Also, in the glucose and insulin tolerance test, so that the glucose and the glucose was significantly decreased, as you can see in panel B and C. So in addition, we can see that the microcyst90 enriched macrophage derived EV treatment led to a greater number of anti-inflammatory M2 macrophages and lower expression of pro-inflammatory genes in the adipose tissues, as you can see in panel D and E. They also conducted the in vitro studies using adipocytes and the primary mouse hepatocytes. So after treatment with micro-690 enriched EVs, both the adipocytes and the hepatocytes express greater level of micro-690, as you can see in panel A. Also, glucose uptake ability of adipocytes and hepatic glucose production in primary hepatocytes were enhanced with treatment of micro-690 enriched EVs. So overall, these results demonstrated that the micro-690 contribute to the beneficial effect of the anti-inflammatory macrophage EV on insulin sensitivity both in vivo and in vitro. Then how did the micro-690 regulate the insulin sensitivity? They also used the target scan to identify the target genes of the micro-690, and they found that the NADK is the potential target of the micro-690. So to confirm this, they also treated the adipocytes and the hepatocytes with micro-690 in vitro, and we can see that the NADK expression was significantly reduced, as you can see in panel A and panel B. Also, level of NADK in liver, skeletal muscle, and the epididymal fat were also reduced by the micro-690. So this result suggested that they also conducted the luciferase reporter assay, as you can see in panel D. So all these results suggested that the NADK is the target genes of micro-690. So the author then evaluates the importance of micro-690 mediated NADK suppression on cellular insulin sensitivity. In panel A, we can see that the adipocytes show higher glucose uptake after knockdown of NADK. So also the hepatic glucose production is reduced in obese mouse hepatocytes after NADK knockdown, as you can see in panel B. In panel C, we can also see that the NADK knockdown resulted in higher level of AKT phosphorylation. However, treatment with both siRNA NADK and the micro-690 EV did not further improve the insulin effect, as you can see in panel D. So overall, this result suggested that the micro-690 NADK acids play a role in modulating cellular insulin signaling. They also evaluate the role of NADK on macrophage polarization. So in panel A, we can see that the NADK expression is reduced in macrophage after overexpression of micro-690. Also, the NADK suppression decrease pro-inflammatory genes expression in macrophages stimulated with LPS. In addition, the downregulation of the NADK in macrophages saw greater level of anti-inflammatory level of gene expression here. So these results show that the micro-690 acids play an important role in modulating M2 macrophage polarization. In total, this study demonstrated that treatment with M2 EVs leads to enhanced insulin sensitivity in both in vivo and in vitro. But when we deplete the EV microRNAs, its effect was prevented. So the second one is that the microRNA 690 is the key insulin sensitizing microRNAs that is highly expressed with M2 EVs. Also, this study suggested that the microRNA could become a new insulin sensitizing agent for the treatment of metabolic disease. So, but there are several limitations in this study. So first, the study was conducted in mice, and the effect in human remains to be further assessed. Also, it would be important to determine whether lean mice will become insulin resistant after being deprived of microRNA containing macrophage-derived EVs. So finally, it is possible that there are additional relevant microRNA targets of the RNA target of micro690 in addition to the NADK. So that's all. Thank you.
Thanks very much, Shubin, for sharing those papers with us and your perspectives on them. And I know that you're not an author on these papers, but you know them very well, probably better than anybody in the audience, maybe. So we do have some questions that have come in. I'm going to invite you to answer, and Qing-Ling, you can also feel free to chime in here. So I'm going to allow people to unmute themselves now, and we will go through the list of questions that's in the chat box. And when I call on you, please try to unmute yourself. If you're not able to unmute, just let me know in the chat box, and we'll have a conversation here with Shubin and Qing-Ling. So let's start. We have someone asking about the microRNA Quang PP. And I think that you have a couple of questions here. So if you can unmute yourself, please go ahead and ask your questions. Let's start with the first one. MIR690 is only one of the microRNAs contained in these M2 EVs. However, there are still other microRNAs, many others, and functional components like proteins. So why is it that the authors focused so much on MIR690 to the exclusion of others?
So for this question, as I will share my screen to you once again. Okay.
Yeah, actually there is another question.
Yeah.
Also about
how. So as I mentioned just now, the author did choose 5 microRNAs to determine their effect on insulin sensitivity. But they found that except for the micro690, the other 4 microRNAs do not have effect on the insulin sensitivity. So they go further to check the effect of micro690, and they found that this microRNA did have some effect on the insulin sensitivity. However, I think it still cannot be excluded that some other microRNAs might have similar effects as the micro690. This is my answer. Okay, thank you.
Okay. That is another question from Lina. The question is how MIR690 is associated with M2 EVs. Maybe this also the answer for this question. Yeah.
Yeah. So whether it's inside the EV or whether it's possible that it's outside.
That is a question because I think in this paper the authors did not check this problem. So maybe they can use some RNAs to treat the M2 EVs and check if the effect will, the M2 EV will lose its effect after the RNAs treatment. I think that will solve this problem, but I think in this paper they do not provide this data.
Yeah, and maybe even a protease and RNase because of the tight association of the microRNAs with their Argonaute protein. So I wonder then too, because I think they were using ultracentrifugation, at least to some extent, in these studies.
Yes.
So do you think that has an effect here? So they got their 100K pellet, but then they did size exclusion as well. So yeah, okay. So that you would think that they would tend to remove some of those non-EV associated, but it's still possible that you could have surface association. Great. Okay. The other question from this particular person was, the authors found that EV is derived from the M2 like macrophages promoted insulin sensitivity. So in the first paper, they were using the adipose tissues. In the second paper,
Yes.
they were using the bone marrow-derived macrophages,
Yes.
but the amount of macrophages was quite limited. So do you think that this is something that can be transferred to a clinical application? And if so, how would that be? That's the question.
Yeah, this is really a question because as I mentioned just now, because the low level of macrophages in the adipose tissue of lean mice, so it takes about, as mentioned by the author in their paper, it takes about 20 to 25 lean donor mice to get enough macrophages for experiment. But it will be much more difficult to do the mechanism study. So in this study, they just use the in vitro induced M2 macrophages. But when considering the clinical application, I think the amount of macrophages is very limited when, even though we use the in vitro induced macrophage. But my opinion is that in this study, they found that micro-690 is able to promote the insulin sensitivity. So the microRNA agents might be a better choice for the macrophage EVs when considering the clinical application. So this is my answer. Thank you.
But I think the big problem for the clinical application of macrophage-derived EV is the immunologic rejection, maybe because
Yeah.
But
I think this paper, I mean, the most important point in this paper is that they found that the micro-690 is a very important microRNAs to improve the insulin sensitivity. So this is the most important point of this study if you were considering the clinical application, because then you can use the microRNA agent for the clinical application.
Yeah, because if you do have questions about the immune side of things, then you might have to actually take cells from the patient, differentiate them into macrophages, polarize them, get the EVs. It's going to be a very long process. But if you can just deliver the mere 690 in some other kind of vehicle, maybe an EV, maybe from another source, then you overcome that bottleneck in the clinical translation. So a question that's related to that,
yes,
is the one from, it was actually asked by Tom Kroll here and also Alex Mitzialis. So if either or both of you would like to follow up on this, but I'll just ask the question, which is about half-life and about duration of the effect. So how long was this effect observed, and does this have implications for the clinical treatment? So how long lived is that effect in vivo?
yes.
Question from Tom. Do you know how long the M2 EVs exert the effects? What's the life of macrophage EVs?
You mean
if you transfect or transplanted macrophage derived EVs to the animal, and how long they will live in the animals? Or
I know the answer, but so in this paper they do not have this data. At least I do not see that data. I did not see that data, but I think most of the EV after injection intravenously, they will be uptake by the macrophages, and then it will be it will disappear from the body maybe up to 24 hours. This is reported by most of the other papers reported by some other papers. And as for the macrophage EVs, I don't have this data. I'm sorry.
What was the longest time point that they looked at for measuring insulin sensitivity?
So I think based on how they administer the macrophage EV to the mice, the macrophage EVs were administered to the mice twice a week, and they do this for 4 weeks. So I don't think the macrophage EV will last for a long time in the body. So this is why they have to give the mice a lot of macrophage EVs for several times.
So it's necessary to have the repeated doses.
Yeah, of course.
To see this effect, yeah. And so, of course, going from the mouse model into a human patient, there would be, you know, a need for a lot of material for sure.
Yeah.
Let's see. We have a question from James Drummond. What are the possible targets of miR-690 that are going to affect these this insulin sensitivity, and might these be potential therapeutic targets, maybe directly rather than using miR-690?
So I think it may be right, because as you can see in this paper, when you knock down the NADK, you can observe similar effect as that treated with the micro-690 mimesis. But so when you consider about the clinical application, it's very difficult for you to for you to use the such as the NADK inhibitor, it will be much more difficult. But if you
I wasn't thinking of an NADK inhibitor directly, but maybe something a little downstream that would be directly affecting insulin sensitivity.
Yeah. I agree. I did agree. But so we are talking about EVs. We're talking about EVs.
Oh, right, but this would be a great tool to find that target.
Yes. So I mean, sometimes EV are just how to say that's a method we can find what kind of components will be effective for the insulin sensitivity. So I think the target of the micro-690 might be the same. I mean,
okay.
Thank you.
Yeah, it's a good. I think it's a very good point, because of the, you know, the magnitude of the effect of a single microRNA is not always huge, right? And so if you can go for the actual transcript or the product of the transcript, that that might be.
Yeah, and current drugs for diabetes are pretty cheap, so you'll have to beat that as well.
But we do see because I'm a clinical doctor, so but we do see that some patients they don't have a very good control of their glucose.
I think some experiments about NADK knock-in should be needed to confirm that macroRNA-690 or macroRNA-690 enriched EV surely promote insulin sensitivity while NADK. And in these papers, they only use the siRNA NADK to show that the effect of to promote insulin sensitivity, but not using overexpressed NADK, and to see whether the reverse effect of macroRNA-690 to promote the insulin sensitivity. So I think that they did not fully identify the downstream signaling pathway of macroRNA NADK in the insulin sensitivity.
You mean, let me see.
Yeah, in one slide, only use the siRNA NADK, but not over expression of NADK to show that the overexpression NADK can reverse the effect of macroRNA. Yeah.
Yes, you mean the penalty here?
Yes, I think they only use the siRNA to further down expression of NADK, but not overexpression of NADK to see the macroRNA surely promote insulin sensitivity via NADK, and NADK is a downstream pathway of macroRNA-690, right?
Yes. I think it would be better to add a group that overexpress the NADK and then treated with the EV to see if the effect of M2 EVs can be mitigated. You mean that?
Yes, yes.
Okay, thank you. Yes.
One of targeted gene, but must to show the function. Use some other experiments.
Oh, yes. Okay, thank you.
Good. Oh, and I did want to go back. I don't know if Alex or Tom had additional comments on the clinical application side. So if you do, please feel free to chime in here. I'm sorry, I didn't ask you to follow up.
No, I appreciate that. He answered it. I think there's more science to be done. Thank you.
All right, then we have a question about the labeling. So there was a labeling experiment where the EVs were labeled with a lipophilic dye, PKH26, and then they were able to see that there was some uptake in the cells. However, were you satisfied with the controls there? Is it possible that they're just seeing dye accumulation? Because we know that these dyes can be relatively promiscuous. They'll label proteins too. Sometimes they'll label lipoprotein particles. They can even form cells of their own. Do you think that was clearly shown that it was the EV uptake or something else?
Yeah. I think in the experiment, I mean, to check the M2 EVs, I mean, sometimes in some studies they use the like the lipid dye, like the PKH26. Actually, it will sometimes it will have some false positive signal. So in my study, I don't use this kind of dye. Instead, I use some like the lentivirus that have the conjoined the CD63 and some dye. We connect them together and then transfect the cells with this kind of lentivirus, and then we can isolate the EVs that have this kind of dye. I think in this way we can prevent this kind of false positive signal. So in my JV paper, I use the lentivirus, that kind of method, not this kind of method. Yeah,
so try to eliminate those false positives potentially. Good.
And
then we just have a couple of minutes here left, but we have a question about the tracking of the M2 EVs. Was there in vivo tracking that was done? This questioner, Ravin F, asks.
I don't think they check the EV in a in vivo system. In vivo system, you mean?
I guess once they're injected into the mice, were there any imaging experiments that were done or other, organ analyses or anything to check?
No. They just do the immunofluorescence staining. They just do that. They do not check the whole organ or the whole body. They do not do that. Maybe I think the dye is too weak to be checked by the whole organ or the whole body.
Right. Yeah. So I mean, and I guess this is an interesting question because these are EVs that are coming from macrophages. I think a lot of the in vivo tracking work that's been done has used EVs from different cells, often from cancer cell lines that are grown in the lab that are very good at producing large amounts of EVs. So there's still a lot that we don't know about biodistribution, even in the rodent model, when we're using EVs from different sources, like polarized macrophages, for example. So there's probably some more work that can be done there to help us understand that.
Yes, I totally agree. Thank you.
Great. All right. Well, that brings us to the end of our hour. And I appreciate all the good questions that have come in and the audience participation here. But most of all, I'd like to thank Qing-Ling and Shubin for joining us today, for sharing your insights into this work and also your interest in this area. So many thanks to you, and I look forward to seeing you again soon, and everyone else. Hope to have you at another EV Club event very soon.
Okay, thank you very much.
Take care, everyone. Bye now.